This is Dr. Tushar Vaishnav, radiologist from Kailash Cancer Hospital and Research Center, Muni Sevashram, Goraj, Gujarat. A prospective study comparing performance of thermalytics with diffusion-weighted imaging, MRI, to identify histologically proven breast malignancies. The rationale behind this study is functional imaging like DW, diffusion-weighted MRI, or thermalytics imaging that analyzes local heat and vascular signal have emerged recently as potential breast cancer detection techniques. They may improve invasive cancer detection since their sensitivity is not limited by breast density or tissue complexity. Here, we evaluate the performance of both thermalytics and the MRI, the diffusion-weighted MRI, in detection of biopsy-proven breast malignancy. Now, what is DWMRI? A short explanation. Diffusion-weighted magnetic resonance imaging is a procedure that measures mobility of water molecules within the tissue, reflecting the cellular microenvironment. At DWI-MRI, breast cancers typically exhibit reduced diffusivity of water molecules and appear hyperintense to surrounding tissues. DWMRI does not require a contrast injection, thus avoiding extra costs and potential contrast-related issues. This slide shows the artificial intelligence of thermal images and how it is processed. It's a high-sensitive early detection thermal sensor, portable, it's safe and non-invasive, and the Niramide thermalytic software gives us an automated, real-time, affordable, and accurate imaging. As you see here on the next slide, no touch, no see, no pain, no radiation. There are 5 protocol thermal images taken for every patient. One is the frontal, that's the 0 degree. Then there is the left lateral, which is 90 degrees. Then there is the left oblique, which is 45 degrees. Then there is a right lateral, which is once again 90 degrees. And the right oblique, which is 45 degrees. An automated interpretation of thermal images using AI is then processed the way you can look at the slide here. And the thermalytic generated patient report is generated the way it is seen near the icon of the patient and the doctor, rather. There are 5 thermal images views which are taken into consideration as told earlier. The hotspot, the vascular calcifiers, and the areolar calcifier is seen and enables the classifier to be seen well. AI for image segmentation is then used, and AI-based thermal image classifiers are used, generating a report which is shown as here on the right-hand side of the slide. Next one. As you see here, the report looks like a typical thermalytics report looks like what it is seen here on the left side, and there is a quantitative scoring here, which is color-coded. The earlier studies of thermalytics, which were not done at our place, are also being shown here to show a comparison, which were peer-reviewed as shown here. Kailash Cancer Hospital and Research Center, Muni Sevashram, Goraj, we conducted a prospective study comparing the performance of thermalytics with DWMRI. Women presenting for routine screening or who have been recommended an MRI and or mammography for diagnosis were taken up. All these women underwent thermalytics first, then they underwent the DWMRI and the diagnostic mammography. Image-guided biopsy, if positive, by either DW, MRI, or mammography was done, and comparison of the techniques with reference to standard of biopsy was also done. The radiologist was blinded to results of thermalytic and vice versa. The demographics, which is shown here, is we have taken the women for both the thermalytic and DWI MRI, were 97 in total. Women for whom both biopsy was also done was 84. So out of the women which were screened, the total number 97 was both, they were subjected to both the thermalytic as well as the DWI MRI imaging, and 84 were subjected to biopsies as well. And the age categories right from 20 to more than 70. This is shown here. Thermalytics versus DWI MRI. The thermalytic positive was 82 positive and 2 were negative. And the negative was 4 and 9 respectively. Biopsy as reference standard was in thermalytics 75 and 4 negative, and in DWI 75 and 4 negative. So performance of thermalytic with DWI MRI as reference standard is then compared, and we came out with this study that they were very much in concordance and they were fitting as regards the two imaging modalities were concerned. Here is just a case study showing how a thermalytic image was very well correlated with the DWI MRI, and ADCs were calculated for the malignant lesion. This is the second case as well, showing the NADCs suggestive of malignant lesion, and there is a multifocality which is also being picked up by thermalytic image as well as on the MRI. Conclusion: breast imaging with techniques like DW, MRI, and thermalytics have advantages over conventional imaging. They do not require contrast medium. They assess the functional as opposed to anatomical state of breast tissue. They are suitable for women with this breast tissue where mammographic sensitivity is low and evaluation of possible recurrence in post-lumpectomy cases, application especially with breast conservative surgery. We found excellent sensitivity of DWI MRI for detection of breast cancer. Thermalytic also showed exactly the same sensitivity and specificity as DW-MRI with biopsy as the reference standard. So, concluding, thermalytics is an excellent screening tool with a significant amount of affordability and portability as well. Thank you.